Hello friends and welcome back. Now we'll be discussing about the second part of seizures in children. In the last part, we have discussed about febrile seizures, which are the most common types of seizures seen in children. Now, this part is dedicated towards explaining you in brief regarding the infections that usually cause seizures. If the fever is associated with fits, the most important differential diagnosis that we usually think is presence of any infection in the central nervous system. There are certain investigations that we usually prescribe at admission which can denote the infections. There are two types of infections that we usually encounter: the viral infections and bacterial infections, or in short we call them as viral meningoencephalitis and bacterial meningitis. The bacterial meningitis is that form of infection to central nervous system which is caused by bacteria. This bacteria gain entry into the human body by nose or throat, causing a respiratory infection, and subsequently this bacteria are seeded into the brain with the blood circulation. Same thing happens with the viral meningoencephalitis also, where the virus gains entry into the body and later on gets seeded into the central nervous system. There is a barrier in between the brain and the other part of the body which is called as the blood-brain barrier, which is a sort of a filtration mechanism that prevents the toxins or bacteria or viruses to gain entry into the brain. When an infection occurs, the blood-brain barrier or the BBB is disrupted, leading to seeding of the bacteria and virus into the brain. This causes infection to the brain. It produces a lot of biomechanical changes in the brain that will cause not only fits but also certain neurological defects. The seizures can be localized to one limb or arm or leg, which we call them as focal seizures, or may be generalized involving the entire body. Focal with secondary generalization is also very commonly seen, which is very hard to describe because the symptoms associated with them are usually very subtle and mild. Parents often miss those mild symptoms. Some form of lip smacking, like this sort of movements, or cyclical movements of the limbs, are also considered as fits. But usually parents don't take this as a serious symptom unless and until they approach us. Unlike in adults, fits need not present with generalized movements of all the four limbs. It can be a silent lip smacking, staring look, and also cyclical movements that can cause the fits. Now, this particular fit has to be differentiated between the other forms of disease. Coming to the investigation aspects, any child coming in with the fits, some essential blood investigations are sent, not only denoting the infection but also certain electrolytes. Lowering of calcium, lowering or increasing of sodium, decrease in magnesium can also cause fits. These are called as metabolic components of fits: calcium, sodium, magnesium, and glucose. Low levels of glucose are demonstrated to cause fits. So apart from infections, metabolic component or electrolyte disturbances should also be considered as the causes for fits. The routine investigations usually include all these panel. Apart from this, the most important investigations are the EEG, the electroencephalogram, which denotes the abnormal electrical impulses of the brain as discussed with you earlier, and MRI, the magnetic resonance imaging of the brain, which is a very essential investigation to find out the structure of the brain. So, in short, the infections, electrolyte disturbances, abnormal electrical discharges, and the structure of the brain has to be studied in detail to know the cause of fit. And once the cause of the fits or seizures is known, appropriate medications should be started. Usually, a neurophysician opinion is usually taken in around 95% based upon the availability to find out any other syndromic association for the fits. Coming to the long-term prognosis, certain types of fits have got a very good outcome. Once put on anti-epileptic medications, usual duration is around 1 to 2 years, and 2 years of event-free period is usually considered to downgrade the medication. Thank you.